This is Lab C, paralleling technique using the XCP, extension cone paralleling. You're going to be doing 5 views on the left side. You're going to do maxillary left lateral, maxillary left canine, mandibular left canine, premolar bite wing on the left, and molar bite wing on the left. In your black box, you have your XCP kit, which includes your aiming ring, the anterior blue bite block, the posterior yellow bite block, the vertical bite wing bite block, horizontal bite wing bite block, and the indicator rod. You will be using number 1 plate for the anteriors, and you're going to be using number 2 plate for the posteriors. You're going to be using the rectangular collimator with the XCP. Last week you used the round collimator for the bisecting. Now I'm going to show you how to set up the anterior PA and the horizontal bite wing. So you will not be using this one or this one. You would only use those 2 bite blocks. We're going to be using number 1 plate for the anterior and the number 2 plate for the posterior. I'm going to give you 2 demonstrations. The first one's going to be with the blue bite block for the anterior PA. The second demonstration is going to be the bite wing with the number 2 plate. So on your bite block you have a slot here. That's where your plate's going to be. You're going to put the A into the slot here. So the A is going to go down into the slot. So your A is down into the slot. You're going to keep it together in place with a piece of tape. And then we're going to put the indicator rod, the color-coded indicator rod, into the holes in your bite block. So now I'm going to show you the indicator rod, inserting it into the bite block. So on your bite block you have holes right here. You're going to insert the prongs into the holes. You can either put it in the first one like this, or you can put it more posterior like this, depending on the palate, how much room you have. So it should look like this. Now we're going to insert the aiming ring, the color-coded channel on the ring, the blue. We're going to place it and making sure it's in the center of your bite block. So make sure when you look through the ring, you can see that the plate is in the center of the ring. And we're going to put a cotton roll on the bottom to support the instrument in the mouth. So it should look like this.
The cotton roll after the prongs are put in. Otherwise.
So put the cotton roll after you've put the indicator arm, the prongs on the bite block. Okay, so this is the assembly for the anterior PA. Now I'm going to show you the assembly for the bite wing. So you're going to use number 2 plate. The orientation of the plate is going to be horizontal. So you can put the 8 down in the slot, or you can do it on the top. It doesn't matter as long as you keep it uniformed. So you're going to put the plate in the center of the bite block. So it should look like this. You have a line in the center of your bite block, so the plate's going to be in the center of that. You're going to put a piece of tape to keep the plate in place. So your setup should look like this. Okay, so we're going to put the indicator rod. The red prongs are going to go into the holes of the bite block. Make sure it goes all the way in. Then we're going to use the red channel on the aiming ring, and we're going to slide it all the way in, making sure you look through the ring. Making sure you look through the ring, that the bite block is in the center of your ring. Okay, now I'm going to show you the placement in the mouth. So I'm going to show you the placement of the maxillary left lateral. So the lateral, I'm going to center it in the center of the bite block here. So I'm going to place the middle of the bite block in the center of the lateral. Bring the instrument up to the lateral and close the dexter gently. Bring the ring as close to the face as possible. So you're going to look through the ring, making sure the bite block is in the center of your lateral. Now we're going to place the collimator into the 4 corners of the ring. So our orientation of the plate was vertical, so we're going to use the vertical inserts, which are these 2 on this side and these 2 on this side. So your collimator here, we're going to turn it vertical.
I can't see what you're doing.
You can't see what I'm showing them.
Right.
I need to turn it this way. That's as far as I could go.
That's okay, but when you turn it, you need to show me what you're turning.
Okay.
They couldn't see. Okay, so when you come up like that.
Okay. So your collimator, you're going to turn it vertical. And we're going to use the 4 corners here to match it to the 4 corners on your ring. We're using the vertical ones. These 2 here and these 2 here. So you're going to rotate your collimator to the vertical position. You're going to align the collimator parallel to the aiming rod, and then you're going to insert the 4 corners of the collimator into the 4 corners of your aiming ring. So we have it in the inserts here, and double check in the back.
Maybe you need to tell them if you don't put it passively, you will move the ring. You see how you just moved the ring? I just backed it up, it's no longer parallel. So make sure that you don't force it into position. You can easily force it into position, but if you back, so right there, show them, so it looks like you're in, but if you back it up passively, it's going to move. So that means you have forced it into a position that it shouldn't be in.
So don't force it, place it.
Yeah, place it gently into, because right now it looks like it's in, right? But if you back it up, you'll see that it's not. See, it's completely in a different position.
So so when I place it in here, I have to make sure that I don't move it.
Exactly. That's the part you need to tell them, because they can easily force it in place in any position they want.
Okay.
And then they want to know why it's not.
So you're going to parallel the collimator to the aiming rod. And you're going to bring the collimator gently into the four corners of the ring without moving the ring. So don't force it, just place it. So you should cover the corners on the top and the bottom on both sides of the collimator.
You want to say, by doing this, you satisfy both the horizontal angulation and the vertical and the horizontal, because it's already in the ring. So you can show them, see the vertical is that middle line, that it's...
The vertical?
You know this is the vertical, this line here. That's your vertical. That's your vertical angulation. It's already there. And then your horizontal angulation is already there. See, the horizontal is now this part. This rod here is also your horizontal, because that's parallel to the bite block, to the plate, right? So that's your horizontal angulation, and the indicator's already set that up for you. And that's your vertical. See that line? That's your vertical angulation, and it's already parallel. So those are things this thing does for you. It does everything except having it as close to the teeth as possible, because right now if you look, it's really far out. So maybe you want to tell them that even though you're using the rod, it satisfies the horizontal and vertical, which you don't have to calculate, because it's already done it.
Okay, so I'm gonna see if it comes out right. By placing the four corners of your collimator, you're satisfying the horizontal angulation to the collimator and your vertical angulation to the collimator. So we're ready to expose the view. Now I'm going to show you the placement for your canine. So you're going to change your plate. Remember the A in the slot, black side towards the ring. So I'm going to show you the placement of the canine. So we're going to center the canine in the middle of our bite block. So you're going to look through the ring, making sure the canine is in the center of the bite block. The buccal surface of the canine should be parallel to your bite block. So you're going to line up the same way using the vertical inserts on your ring. You're going to align your collimator into those. So you're going to parallel the tube head to the aiming rod. That's your vertical. You're going to insert the collimator into the four corners without forcing it into the ring. So making sure that the four corners are in on the top and on the bottom. Now you're ready to do the exposure. Change the time on the control panel for the exposure. So now I'm going to show you the setup for the lower canine. So we're going to use the same setup. We're just going to flip the instrument over. So for a dextra, you can use it like this. But for a real patient, you have to modify it because we don't want the right angle of the rod to hurt the patient's cheek. So we're going to modify the XCP. So we're going to, for the lower left, we're going to bring the right angle on the right side. And we're going to put the prongs in here. So this part of the arm will not hurt the patient on this side. So your assembly should look like this, making sure your plate is in the center of your ring. Then we're going to put a cotton roll on the top to stabilize the instrument. So this is your setup. Okay, so we're going to place the bite block in the center of your lower canine. Close it gently and bring the ring close to that patient's face. So your plate is parallel to the buccal surface of the canine. Look to the ring, making sure that the canine is in the center of your bite block. Now we're going to place the collimator. So it's going to be vertical. You're going to parallel the collimator here, parallel to the aiming rod, and we're going to use the four corners of the ring, vertical, and align your collimator into the four corners. So just place it in there, do not force it, making sure the four corners are in. Now we're ready to expose it. Make sure that you check the exposures for the lower canine. Okay, now I'm going to show you the bite wing placement. So I'm going to show you the placement of the molar bite wing on the left side. On your bite block, you have a line in the center of the bite block here. We're going to use this line to center the second molar on the bottom. So we're going to place the plate parallel to our molars using the center of the bite block on the center of the second molar. Close the dextra completely and bring the ring as close to the patient's face as possible. So for your molar view, your guide is the outer canthus of the eye. So now we're going to align our collimator. So we're going to rotate the collimator horizontal. And we're going to use the horizontal lines. We're going to align the four corners of the collimator into the four corners of your ring. So we're going to parallel the collimator first to the aiming rod, and then bring your collimator into the four corners, making sure they're in on the top and the bottom. This is your horizontal angulation to the buccal surfaces of the molars. And this is your vertical angulation. The arm to the tube head. Now I'm going to show you the placement of the premolar bite wing. So on the premolar bite wing, we're going to follow the arch of the mouth, placing the plate parallel to our premolars, looking through the ring, looking at the edge of the plate to capture the distal half of the canine. A guide for your premolar bite wing is the middle of the plate, the middle of the pupil. Now we're going to place the collimator. So we're going to parallel the tube head, parallel to the aiming rod, and then we're going to place the collimator into the four corners of our aiming ring. So you're going to place it in gently. Do not force it. Making sure that the four corners of the collimator are aligned to the four corners of the aiming ring. Now we're ready to expose it. Double check your exposures on the window.